Welcome to the Ambulatory Healthcare Today podcast, hosted by the NextGen Advisors. Accelerate your success with insights from a multidisciplinary team of healthcare experts as they discuss an array of topics. These timely discussions can help you better navigate the challenges of running your ambulatory care practice. Here is your host.
Hello, this is Dr. Marty Lustig with NextGen Advisors. For today's podcast, I'm joined by my fellow advisor, Graham Brown, and a special guest, Dr. Jennifer Bolduc, a fellow pediatrician and NextGen's VP for Population Health. Welcome to you both.
Good morning, Marty.
Thank you, Marty.
In our podcast on October 12th, we discussed the results of a NextGen Commission survey by Extelligent Healthcare Media on the role of HIT in supporting patient engagement. Today, we'll be delving into the results of Extelligent's follow-up survey with ambulatory practices that focused on the status of their population health initiatives and the use of population health tools in their organization. Before we get into the results of the survey, Jennifer, can you remind our audience of what we mean by a population health platform? How is it different from an EMR?
That is an excellent question, and maybe I want to reverse the order of that, because I think most people are more familiar with the EMR than they are with population health tools. So in my mind, from my perspective, an EMR is really designed to support the clinician as they're taking care of patients one by one by one, right? Then that's what they do, and they have varying degrees of access to patient data that exists outside of the EMR. Population health is almost the complete opposite, right? It casts a much wider net. So in our tool, for instance, we grab a hold of all the patient data we can get from a multitude of sources, right? And we bring all that together in one place, right? And so from there, we use that multi-source data to provide a wide variety of views into the healthcare organization's population. But what we're trying to do there is allow a lot of different ways to look at a healthcare organization's patient population, right? So we're looking to group patients by maybe some clinical aspects or by payer aspects. And then we can also manage the clinician's patient population, right? That's actually the fundamental view for population health, is to answer the question, what is my patient population as a provider? From there, we can apply risk algorithms and quality metrics to either that group of patients or to that provider's patient panel. So those are just some instances of how we look at population health. From there, from that big net, that wide net, we can drill all the way down to the patient level and give that provider a view of data they may have no idea is even there, that they just don't even know exists about that patient, whether it's from claims or lab feeds or other EMRs, or even their own PM system. They just don't have that view. So very different views of the world.
It's very helpful. It sounds like, whereas the EMR starts with, as you were saying, with the individual patient, and then they search from that point. Population health starts with the whole population and then enables you to drill down and find the individuals that are appropriate. Thanks for making that distinction. Let's move to the survey now. Consistent with our prior surveys that NextGen has sponsored, the most recent survey, the majority of ambulatory practices, 56% actually, already have HIT solutions in place and are currently focused on optimization. 83% of them report that HIT was either a medium or high priority for them. Jen, do you think these results mean that clinicians have fully accepted HIT as integral to the way they provide care?
Yes, I do. Marty, actually, I don't know. I think it's great that you chose the word accepted. In my mind, I think I kind of went more along the lines of maybe resigned to it. But at this point, I would think that most clinicians would be uncomfortable without health IT. I kind of turn that around and think, what would it be like to practice without it today? And I don't think that we would be comfortable without that support. What I think providers are really looking for is the payoff, right? They want it to give back to them. And that's where population health comes in, right? To try to provide those insights, actionable insights, so that they can get that reward for all the data entry that they've done.
One of the elements that kind of surprised me a little bit in this specific number, 56% have health information technology solutions in place. I wonder if that's a little bit skewed in the results around population health solutions versus other electronic solutions in the practice environment. When we think nationally, certainly, we're above the 85-90% of adoption overall of electronic tools in the clinical environment. And so I think this is a little bit skewed maybe around some specific solutions. And the element around 83% reporting that it's a high priority or medium priority, that feels pretty consistent for me with what we're hearing. Just in our interactions with provider and ambulatory practices around the country, HIT solutions continue to evolve, how they're used within the workplace, and really all of the different connections that staff members in a team model have to the technology in their role, in their transition of managing a patient from one care provider or to the next individual. HIT is really integral to what those work processes look like, and they often need to be revisited and revamped and optimized, to the word that's in the survey question here, to ensure that folks are getting the best use out of it and really making their practice efficient. And those things take regular tweaking and updating to ensure that they're happening well. So that optimization percentage is pretty consistent from my perspective.
Thank you, Graham. In that vein, in the survey, there was a question about provider expectations for what these solutions what value they would provide for them. And three themes that emerged: patient outcomes and financial return on investment were each cited by 58% of the respondents, while interoperability with existing systems came in close to 54%. Graham, is this consistent with your lived experience?
It certainly would be in today's age. From my perspective, the expectations of providers around the role of health information technology has evolved in the 15 to 20 years that we've seen broad adoption and integration into clinical practice. I think if we look back 15 to 20 years ago, these weren't necessarily the expectations that providers had, but the products have matured. Their knowledge and utilization of them has matured. And so certainly today, the ability of one system to speak to and connect with and draw data from or send data to another system is foundational when we think about a provider practice in the ambulatory world working in collaboration with specialty providers, with laboratories, with other diagnostic services, with hospitals and health systems, with payers and health information exchanges. All of those pieces need to be connected. So certainly that would be a priority and an expectation for providers. And on the outcomes and financial return side, these are expensive systems for practices to put into place. And healthcare certainly recognizes that this has an expensive element to their operating budget, and then need to get a return out of these systems. And some systems are better than others in creating a financial return because of their ability to process claims efficiently, to capture data accurately at the point of care. All of those elements really inform how effective the tool is. And I think providers are much more savvy than they would have been 15 years ago to recognize that this is what these tools need to do for them if they're going to adopt them and put them into practice.
Graham, I completely agree with that. What you just said resonated with me entirely. I think that we are more savvy, right? And we have much higher expectations than we used to have. Absolutely. And yes, there must be financial and clinical results from these systems. And it's not just the dollars, it's the effort and the time. And so I think about these two themes, and I think this translates in my doctor mind to, this better be worth my time.
The patient outcomes are still on a par with the financial return. If you think about the meaningful use and all that was done by the government to try to force people, and both entice and force people down this path, with as you were saying, Graham, these big investments in time and money, that they still can see patient outcomes as a big priority here, but in the midst of all those other issues is a positive in my mind.
Yeah. And I know we'll go there, but I think that to me is also the focus of population health solutions in particular are around outcomes. And they do drive to better clinical outcomes and certainly financial outcomes for an organization when deployed and used properly. Less so, I think, is that always the focus of an EMR, which is kind of a basic operating system you need to have to run your practice. But when you think about investing in a population health solution, it takes you to a totally different level in terms of your organization's ability to impact those outcomes and to really be much more sophisticated in how you're providing care and your view of the needs of your population and whether those are being achieved or not.
Well, that's a great segue, Graham. So let's move to the population health results from the survey. And respondents really identified 4 capabilities that they felt were important to them in this space. 55% called out identification of care gaps, 53% stratification of clinical risk, 40% integration of claims data, and 19% supporting management of transitions in care. Jen, are you at all surprised by these results?
No, Marty, I'm really not. These results are really consistent with what we see across our client base and where they are with operationalizing population health. The first priorities are oftentimes closing gaps in care and focusing on that part of population health, and then understanding and documenting the acuity of their populations. Once they've mastered that, oftentimes they'll start to move on to focusing on really containing the cost of care or trying to understand and impact the cost of care. And it wouldn't surprise me in the least as we progress through this that we'll then move on to managing social determinants. That would be the third area where I would go as I watch this progression.
Mm-hmm. Yeah, I agree with what Jen's saying here. And to me, again, this kind of reflects the maturity of the adoption of these tools. To your point, Jen, you start with the gaps in care, you start with kind of the low-hanging fruit, and you recognize if I improve these gaps in care, my documentation improves, the basic preventive services for the patient are probably being addressed, and I get to the place where, as a practice, I can start to think more proactively about what does this, group of diabetics I'm caring for, this group of COPD patients or CHF patients really need on an ongoing basis, and how do I ensure proactively that's what I'm going to undertake, do outreach, do initiatives that support really managing that population in a way that's not just reactive, but really is having the best interests of the long-term future in view.
Right. You've got to focus care on the patients who need it the most. And that's what population health is all about.
One of the things that's not surprising and striking to me in this is the gaps in care, as you mentioned, is far above others. It's follow the money trail. This is where most of the money is in terms of the contractual arrangements that providers have today. And as that contractual relationship matures, I think the other issues you're describing hopefully will become more prominent. But going back to these 4 themes, Jen, can you talk a little bit about NextGen's population health tool and how it is positioned to actually meet those needs particularly?
Absolutely. We can take them one by one. So let's talk about, first of all, the care gaps, right? Since that's everybody's highest priority. And for NextGen Population Health, our care gaps are generated by quality measures, and we support a number of programs, right? A number of quality measure programs. So we have ECQMs, we have HEDIS measures, we have Indian Health Service quality measures and UDS measures, and also some custom measures around annual wellness visits, for instance, for Medicare, or COVID immunization metrics. And where applicable, those generate those care gaps, which is super, right? We have a lot of different ways of supporting gaps in care within the application, and then actually also right at the point of care, and we'll probably get to that part later. For clinical risk, that's the second one. We have 3 embedded risk algorithms. Right? So we have ACG, we have HCC, and ASCVD. In my mind, the Johns Hopkins ACG risk stratification tool is the gold standard, and we apply that left and right. It's just so valuable to our risk stratification efforts. So that's we've got that 100%. Claims, claims are tough. Claims are difficult to manage, and our team supports that beautifully. We ingest claims all the time. We're learning more about every different single kind of claim you can imagine every day. And that's been just a great addition to both clinical and financial analytics. That's something that sometimes we forget about. We tend to think of claims as being really more about the financial part of this, but claims information adds a lot to our clinical analytics as well. So I'm delighted to see that we're doing that more and more. And then the fourth one we had talked a little bit about, or maybe we didn't actually, was the transition of care. That was a little lower priority in the survey, but it's still really important. I think it might have been lower in the survey because a lot of people have ways of dealing with that today. But I think in our tool we support that in a better way, right? Better than managing spreadsheets and trying to tackle that. We've got a tool that allows you to identify patients who have been discharged from multiple inpatient sites, whether it's an ED or maybe even a SNF, right? So we can find those patients easily, and we can refer them directly to our care management tool for our care coordinators and care managers to reach out to. I think that's more a matter of a how, right, than actually what in that case. But yes, I think we support all four of those beautifully in our tool.
Thank you. Let's talk a little bit about other capabilities. Graham, what do you think other capabilities of population health that are important to providers that maybe weren't highly ranked in the survey, but worth talking about?
Yeah, I'll address a couple of them from my perspective. Let's start with, the movement of provider organizations into alternative payment models, value-based payment, and risk contracting, and partnering with providers in ways to manage the cost and quality of care. As a result of those pressures within the industry and that overall dynamic, the ability to look at how providers within a practice group or within a health system or within a network are meeting the needs of patients, but also addressing the cost and quality objectives of their managed care contracts becomes front and center. So some of our population health solution capabilities look at quality and cost variation amongst providers. You can look at an entire health system. You can segment different groups by specialty. How are they performing? You can look at providers in one practice versus another practice. You can look within that practice and recognize that Dr. X versus Dr. Y may have very similar patient panels that they're serving. And one of them is really great at doing all of the preventive outreach work and getting those annual care visits done, documenting those visits. And another one really hasn't integrated that very well into their workflow. That's not something that they're paying attention to. They're not driving the outcomes in that regard. So cost and quality variation is a really important feature that allows managers and physician leaders to really identify where are some of our process gaps, where can we address as a collective group of physicians the impact that we're making, and who's an outlier right now in that area, and bring some clarity to that so that the conversation can be had in a really meaningful data-driven way. And that we've seen time after time really helps physicians get their head around where they need to go with quality measures, because that's not what they're focused on day in and day out. They're focused on the patient in front of them. And it really supports them with meaningful, objective information to address some of those objectives that they're trying to achieve as an organization. Related to that, then, is understanding, say, for a managed care contract, you might have an initiative with your payer to look at individuals that have COPD within your community. You can identify through our tool the whole group of individuals that have COPD, that are at risk for COPD, how they're being managed, whether they're getting all of the services, the diagnostics that are needed to track their disease, its progression, and whether they're having any exacerbation from their condition. So the ability to then create cohorts and look across your entire panel of individuals and do outreach to them to say, you know what, we want to bring all of our COPD patients in for this evaluation and assessment to make sure that our data is up to date and that we're managing them effectively, they have a good plan of care. All of those capabilities are built within these population health solutions and certainly within NextGens. And those are really important features when I think about our ability to really manage population health and public health over time.
And I would add to that between visit care with care management, right? There's only so much that the provider can do at the point of care. You try to stuff all that in, but there's still a great need. When you think about it, whether it's a pediatric practice or internal medicine practice or other, you see that patient at most a couple times a year. But there's a lot of space between and a lot of places where that patient can be lost. So care management, as I'm hearing, is an increasing need across all kinds of sizes and shapes of organizations. So yes, that should be supported within a population health tool, and we support that within ours. That between visit care, getting those care coordinators in there, getting the care managers on top of the situation, whoever's acting in that role, or it doesn't have to be that title, someone acting in that capacity has to be engaging with that patient between visits. So that's another one in my mind.
Listening to you both, it sounds like we're kind of just scratching the surface of what population health, a good population health platform can enable in a practice. It's really exciting. Let's move a little bit in terms of integrating this capability into the workflow of a practicing provider. That's clearly a theme that's important to the providers themselves. Jen, can you talk a little bit about what you see as the critical attributes of how that integration is with population health?
Absolutely. No one can, of course, see this, but as Marty's speaking, I'm nodding my head vigorously because that is actually the most important thing, right? I mean, when you're talking about population health, great to generate those insights, but you got to get them to the right people and they've got to be actionable, right? So to me, I think of three critical attributes. First of all, Pop Health Tool, you can't have a separate login for providers working at the point of care. You can't always be forced to go to a separate tool with another login, another password. You can't force the provider to spend their time searching, right? You've got to deliver it up at the point of care. And then secondly, I really feel like the insights need to be focused and ideally matched and prioritized to both the organizational and the individual providers' priorities, right? And their practice patterns, their patient population, the needs of the organization. You need to be able to personalize these insights. And then third, and probably the most important thing, is everything that we're talking about has to be actionable, right? You don't want to, it's just, you got to be able to act on it easily, right, at the point of care and get that work done. So those are the three critical attributes.
Very helpful, thank you. So overall, it seems clear that with the increasing role of alternative payment models, that these population health capabilities are going to be even more foundational to most, if not all, providers going forward. I'd like to thank my colleague Graham Brown and our special guest, Dr. Jennifer Bolduc, for joining me today, and thanks to you, our listeners, for joining us. Please click the subscribe icon to be notified of future podcasts. This is Dr. Marty Lustig with NextGen Healthcare. Have a great day.
Thanks for listening to the Ambulatory Healthcare Today podcast, hosted by the NextGen Advisors. Never miss an episode by subscribing at nextgen.com/podcast. To see a list of products and services tailored for ambulatory care practices, visit nextgen.com.